late 2016, I was picked up for a hit and run, and my probation officer had me put on a probation hold. The hit and run was dismissed, but it saved my life, and I got on Vivitrol. And I was on that for 7 months, had a bunch of dental surgery done, and had a one-time use. And that happened because I cashed my check and my old dealer was outside. I was weak, hadn't had my shot, and I overdosed on job site. I came to before EMS got there, but I was not very coherent. The EMS, I asked them for Narcan, and I felt a lot better.
So the role of naloxone is a really important one. Naloxone is the opioid overdose reversing agent. That's really the primary intervention if someone has overdosed on an opioid. And it's quite a safe medication.
Naloxone reverses death. So for all technical purposes, the person who overdosed, they died.
If you suspect somebody is overdosing, the first thing you want to do is immediately call 911. You never know what situation you may be put in, how worse the person can get, or even if it is an overdose. So calling 911 is the simplest thing you can do to help save that person. The next thing you can do is administer naloxone by using either form of the drug itself and administering it as fastly as you can. I'm Ben Brusso. I'm a prevention specialist at the AIDS Resource Center of Wisconsin in Appleton. You can tell when somebody is overdosed. There's a few telltale signs. The one sign that you can look for is respiratory depression. Blue fingernails, blue fingertips, somebody who's not responsive, shallow or no breathing, anywhere from less than 5 breaths a minute to no breaths at all. Gurgling sounds. There's lots of different signs that you can tell if somebody's overdosing.
The big thing to do is to call 911. If you have Narcan available, administer Narcan right away. There's really no complications of using Narcan. If the person has altered mental status and it's not because of overdosing on opioids, you're not going to harm them by giving them Narcan. So there's really no contraindication for it. And with overdose prevention, the naloxone, the common myth is that it encourages people to use, that if they have naloxone that they're going to be more comfortable using, and that's absolutely not true. When you look in Vermont and some other states where it was used, there was no increase in use, even though there was a heavy push towards making naloxone availability there. So that the myth and that it encourages use is absolutely false.
I would argue anyone who takes opiates should have naloxone available, regardless if it's one pill every day. There's no harm in having it available, and the upside of it is huge.
So naloxone ideally should be widely available. So if there's anyone in your family has opioid use disorder, is an opioid addict, then that's something you should definitely consider getting, just because a matter of minutes can save someone's life. It's
become legal and acceptable for lay people to possess and administer naloxone at the scene of an opioid overdose. And in fact, the literature tells us that individuals who receive naloxone due to overdose are more likely to reduce their use.
There's a few different ways you can administer naloxone. One would be in a nasal form, another one is in an injectable form. Both of them are very, very simple to use. With the short training, anybody can do it. They work the same. They work in the same amount of time, and they do the same things for the person who's overdosing. So this is the nasal version of Narcan. This is the easiest route of administration. You can get them at harm reduction centers across the nation. You can also access these from any pharmacy. In Wisconsin, there's a standing order for naloxone, and you don't need a prescription to access it. Some insurance companies will cover the cost of naloxone. And the reason that you would want to carry naloxone is to save a life. You never know where you may go, where somebody may be experiencing an overdose. You never know who may be experiencing one. And keeping this on hand is as easy as possible. These simple doses here, this is 1 dose of naloxone, that can be used to save a life. One program that we are mobilizing currently is to get fentanyl test strips, which help somebody who is using drugs test their drugs for fentanyl analogs. It's a proactive way to prevent overdose death.
We know that treatment works, that recovery is possible, and so the role of naloxone, of course, is to keep folks alive so they can get there. And we know that they all can with the right support.
If anybody's interested in naloxone and they need resources, there are naloxone search tools online where you can search where you live and you can find naloxone in your area. You can visit www.arcw.org for more information on ARCW programs, including the Opiate Overdose Prevention Program. And you can visit any harm reduction program around your area to find more information about naloxone and overdose prevention. You can also contact your local health department who can help steer you in the right direction.